President Trump's medical team says that he's dealing with chronic venous insufficiency. It's a common condition where veins in the legs don't return blood to the heart like they should. The White House says the doctors ran a full round of tests and found no signs of anything more serious. Doctors say it's manageable and not unusual for someone his age.
Our medical expert, Dr. Payal Kohli, is here with a closer look at this condition. And Dr. Kohli, what do you think people, because I saw some chatter online about a week ago, what do you think people were noticing that kind of sparked this diagnosis?
I think his physicians noticed that he was having some swelling in his legs, and that's called edema. So the first thing we do when we think about someone having swelling, is it one side or is it both sides? Then we think, is it a local problem with the blood flow either to or from the legs, or is it a systemic problem, like blood from the heart is backing up into the legs? That's called congestive heart failure, or the liver or kidneys are failing. That causes swelling in the legs. So the good news is with the president, they checked everything out. It doesn't seem to be a problem with blood flow to the legs. The arteries are intact. There's no clot or DVT, deep venous thrombosis in the legs. His labs all came back normal. He had ultrasound of the heart called an echocardiogram that showed he has no congestive heart failure. So really benign diagnosis for something that could be concerning because your legs get swollen.
The focus, we keep seeing pictures of the president's legs.
Yep.
Everybody's focused on that.
And the ankles, people are showing the ankles.
The ankles, but the hand abrasions are something we've seen as a symbol or symptom of this as well.
So this is completely unrelated. So this happens to a lot of people as they get older. It's in fact called senile purpura because you get purpura or ecchymosis, purple discoloration of the skin on the back of the hands. And if you think about the skin on the back of our hands, it's very thin. As we get older, the blood vessels under those are like tissue paper. They can tear really easily. And this is a high traffic area. Plus the president is taking an aspirin every day. So all of that put together makes it likely that he might have more lesions on the back of his hand. That's a completely benign condition, and it's unrelated to his venous insufficiency. With venous insufficiency, you get that swelling at the end of the day that gets better when you raise your legs. You get achy legs, you get heavy legs. So it causes symptoms, but it's not really dangerous.
So if your client was, you know, I don't want to say suffering from this, I don't know if that's the right word since it is kind of common in this age group, what do you think he can do to manage those symptoms? And would you keep a keener eye on your patient after this or no?
No, I certainly would. And the reason is because untreated chronic venous insufficiency can progress to significant problems. So think about your legs being swollen all the time. If you don't treat it or do anything, A, it's going to get worse. So it's a progressive disease. The swelling's going to get worse. The heavier the legs get, the more leaky the blood gets in the legs. And B, that chronic swelling can lead you at risk for skin breakdown or ulcers. It can lead you for risk of infections like cellulitis of the skin, and it can cause chronic problems. So certainly I'm going to keep a closer eye on my patient if I find venous insufficiency, but I would recommend compression stockings every day, especially for someone like the president who stands on his feet for most of the day or his legs are dangling because he's running around. Elevation of the legs for at least 30 minutes twice a day if he can, and of course at night as well. Exercise, that's critical because those leg pumps, the muscles actually pump the veins and squeeze them and push the blood back. And then I think our president should lose a little bit of weight as well, because the more weight you're carrying, the more weight on those valves in the legs and the more that they leak.
Are you worried? Because this was treated as like such breaking news yesterday, and it was like almost like this groundbreaking thing. Are you worried about his health in general?
No, actually. I think for 79 years old, our president is doing really well. Now, if I was his physician, I would ask myself, I don't know why he's on an aspirin, but if he's bleeding in the back of his hands, does he really need an aspirin every day? Does he need it a few times a week? So I certainly would ask myself that as well. I would also probably start screening him more aggressively at the age of 79 for a lot of these age-related issues. And certainly, like I said before, I would talk to him about maybe dropping a little bit of weight, just because from a cardiometabolic perspective, that's much healthier. His waist circumference is a little higher than it ought to be. And now that he has this condition, it's certainly not going to get better. It's going to get worse if that weight doesn't come down.
We talked about that's the key to so much, right?
Yep.
The key to health in general is
So
getting that weight off.
Yeah.
Well, Dr. Kohli, thank you.